My name is Nicole Rasul, and I will be presenting a psychological case study on Miss Delia Doe, who is a female whose age is approximately 50 years old and who is seeking treatment for depression. She has significant life challenges, which currently are a recent divorce. Her last child moved out most recently. She describes her job as a dead end job, and she feels as if she has few friends. So, in this analysis, we are going to determine which psychological therapy would benefit Delia the most. So, we are going to compare and contrast two different types of psychological therapies. First of all, that will be cognitive behavior therapy or biomedical therapy. So, the first one we're going to cover is cognitive behavior therapy. So, some key components about cognitive behavior therapy is basically it changes the way one thinks and acts. So, it aims to do this by changing cognitive distortions and self defeating behaviors. Cognitive distortions can be of three different types, for example. That being one of overgeneralization, another one of being jumping to conclusions, and the last one, all or nothing thinking. So, we can give an example of these different types of cognitive distortions. So, for example, say someone is in a situation where he or she meets another person at a beach and enjoys time with that person all day long. They have a great time, and he or she thinks that they got along well. With the all or none thinking, this cognitive distortion, he or she may have a dialogue within them, their own internal dialogue, thinking the following: she didn't like me. I'll be all alone forever if, for example, that person didn't respond to their call when they tried to call him. With the overgeneralization thinking or cognitive distortion, they may think that I'm ugly, no one will ever want to be with me. Or with the jumping to conclusions cognitive distortion, he or she may think after having left a message for the person and not receiving a message that I left a message and she's not returning my phone call. She probably doesn't like me. So, jumping to conclusions. So, those are some just different examples of cognitive distortions that this type of behavior therapy aims to change. Um, Also, they're trying to replace negative, irrational thoughts with new, more positive ways of thinking. And finally, this type of behavior therapy will give the patient the opportunity to practice and engage in positive approaches to daily situations that they might experience in life. This approach also uses the ABC model. So, that being action, belief, and consequence. Action refers to the activating event that may cause someone to become depressed. The belief is how that person responds in terms of what their thinking system is to that activating event. And then, as a result of that thinking and that belief, the consequences, the actions that the patient will then pursue as a consequence of what they're believing. So, that's a model that therapy would use and help the patient analyze their different approaches to different situations. Now, the next type of possible therapy for Miss Delia would be biomedical therapy. Now, biomedical therapy changes the way one feels. So, its aim is to improve the way one feels, and it does so by giving psychotropic medications that can be used to change the chemical levels in the body. So, specifically for treating depression, antidepressants are used, for example, Paxil, Zoloft, or Prozac, and Tofranil or Elavil. Now, Paxil, Zoloft, and Prozac are actually what are called serotonin reuptake inhibitors, selective serotonin reuptake inhibitors. And so those are Paxil, Zoloft, and Prozac. And what they do is they stop the reuptake of serotonin into the presynaptic terminal, thereby perpetuating the effects of serotonin on the brain, leading to a less depressed state. The other medications, Tofranil and or Elavil, those are both what are called tricyclics. And tricyclics also lead to antidepressant effects in a similar manner. However, they not only block the reuptake of serotonin, they also block the reuptake of norepinephrine. Now, these types of medications come with some different side effects that can be a very difficult thing for some patients and need to be considered. So, for example, selective serotonin uptake inhibitors could lead to headache, nausea, weight gain, drowsiness, or reduced sex drive, whereas the tricyclics could lead to dry mouth, constipation, blurred vision, drowsiness, reduced sex drive, and increased risk of suicide. So these components or these side effects need to be considered when evaluating whether a patient can actually take these types of medications for antidepressants or to treat depression. Now, which one therapy is the best? Well, my recommendation is cognitive behavior therapy is preferred for standalone treatment. And there are several reasons why I would recommend this. So, first of all, studies have proven that cognitive behavior therapy to be one of the most effective psychological treatments for depression. It focuses on the present day, which is good to give patients the opportunity to practice what's going on currently in their life. It also allows patients to practice the positive behaviors and follow up with analysis from the psychologist. So it kind of gives them that homework and helps them implement what's going on in their therapy sessions. And it doesn't change anything chemically in your body like biomedical therapy does. And this is probably the strongest reason why I think a cognitive behavior therapy route would be preferred, at least as a first method to use, because it doesn't have the effects on the body that could be detrimental. So obviously, if you're not taking medications, you're not getting those side effects. Also, if you're not taking medications, you're avoiding any long term risk that may be associated with taking medications. So, using cognitive behavior therapy as a standalone treatment would be preferred. However, it would still depend on the patient and their preference as well. You know, it really depends on how the patient really feels about taking medications, how depressed that they feel in their current situation as well, and how therapists might feel that certain medications would work for that patient. So again, my preference would be to do cognitive behavior therapy as a standalone treatment, but again, biomedical therapy may be a route to go. So that's all I have. And hopefully, Delia can have one of these two, or hopefully just the cognitive behavior therapy, and see some improvement and some antidepressant effects happening for her. Thank you for listening to my presentation.